I want to take just another minute and tell y'all something really, really exciting and important that Alzheimer's of Central Alabama has been doing this week. We have a number of people on our service programs who live in rural communities. Many of them are low income, and they had asked us if we could provide masks for them. And so we put together what we called emergency medical kits. And we have now, we're in the process of distributing about 225 of these emergency kits in 20 counties across Central Alabama. And our junior board, our board members, some volunteers, and first the Vestavia Hills United Methodist Church are helping with those deliveries. And I've just got to show y'all something. The church, Vestavia Hills United Methodist Church, made us these fabulous fidget blankets for all of the folks that are getting emergency medical kit, and they've got all kinds of things on them, keys and pockets and just a lot of things to play with. And we've got some extra ones, and if anybody out there would like a fidget blanket, again, please contact us and we'd be happy to share one of these really, really cute homemade things that might keep your loved one occupied when they become agitated. So having said all that, I'm going to start by introducing Nicole Ruggiano, and we're so grateful that she is able to be with us today. Nicole has spoken at our conferences before, and she is always a very, very welcome breath of fresh air. She is an associate professor and DSW program director in the School of Social Work at the University of Alabama in Tuscaloosa. Her research and advocacy work focuses on improving access and quality of care for people with dementia and their families. Her research specifically focuses on developing testing technologies that are designed to support and educate caregivers of people with dementia. And she's also very involved in promoting caregiver-friendly policies at the local, state, and federal level. And that's actually what she spoke about last year at our conference, and it was very informative. Another, I guess we'll call it an honor, is she's just been appointed to the Lifespan Respite Advisory Board, if I got that right.
Coalition.
And she may tell us a little bit more about that, so we'll all know the important work that they're doing. So without anything further, Nicole, we'll let you get started. Thank you.
Hi, Miller. Thank you. So it's nice to be here talking to everybody about this important issue of caregiving during COVID. The caregiving for people with dementia is very important to me. And so now that even with us distancing, to be able to reach out and still help caregivers is really important. And as Miller mentioned, I recently was appointed by the governor to the Alabama Lifespan Respite Coalition, which works on improving access and quality of respite care for families across Alabama. I can't say too much more about that because I just learned about being on the coalition. So maybe the follow-up, I can tell communities more about what's going on with the coalition, but I'm very excited about that opportunity. I'm going to share my screen. I have a presentation to share. So those of you who are calling in might not be able to view it, but if there are any questions about it, as we, let's see. Sure. If there are any questions about it as we move along, just feel free to ask in the chat. And also, if anybody who can't see the presentation would like a copy of it later, you can email me, and my email will be at the end of the presentation. So if we look at the issue of caregiving before this COVID-19 pandemic came, and I'll use interchangeably COVID-19 and coronavirus, but they're the same thing. Caregivers were already stressed and had a lot of burden and challenges without a pandemic that required a lot of businesses shutting down, people staying at home, and disruption in our lives. So the thing is, even though we see so many people in communities feeling very stressed and challenged by the COVID-19 pandemic, caregivers were already going into this pandemic with a lot of stressors and struggles that in some cases have gotten worse for them. So if we even look before the pandemic, and I've interviewed caregivers across the state. In terms of research, I do a lot of my research in the homes of caregivers. I go visit them, I interview them, I see what kind of environment they're providing care in, and a lot of the day-to-day struggles that they go through. So if we look at what are some of the common challenges for caregivers for people with dementia in Alabama, even before COVID-19, many people report that they have a lack of informal support network. So many of you caregivers, you are the only caregiver or the primary caregiver. Many of you report that you don't have a lot of family or friends that help with caregiving. And so that's a big challenge for many caregivers. Caregivers report that their coping skills are overwhelmed. I mean, some caregivers of people with dementia are caring for someone for 10 or more years sometimes. And so that is a long time to handle a very stressful condition such as dementia. And so, over time, it's very easy for caregivers to feel like they're having more trouble coping than they used to. There's also a low use of formal and informal services. So oftentimes I'll go and meet caregivers and I'll ask them about respite care and they'll say, what is that? I've never heard of that. Or I would say, hey, have you ever tried a support group for caregivers? And they'll say, I didn't know that those things were available, or they are too far for me to drive because I live in a rural community. And some caregivers, the person that they're caring for requires such a high level of care that they feel like they can't leave them, even maybe with others, to attend services. So even though there's services out there, oftentimes there's many reasons why caregivers aren't accessing them. And also caregiver knowledge deficits. One thing I will say about caregivers, they always want to learn more. They sign up for so many educational events like this one. When I interview caregivers, they want to know what other caregivers tell me in their interviews because they want to learn from other caregivers. And so even those who are very savvy, know a lot about Alzheimer's disease or other type of dementia, caregivers always report that they want to learn more about dementia and caregiving. And so, but that's also a challenge. There's also, in some communities, not a lot of education and information about dementia. So we see in some pockets of communities, people think that dementia symptoms are just normal aging, and they're not. And so they're not going out to get the right type of health care or other type of test for their loved one that's available. And also the care recipient problem behaviors. So when somebody has dementia, oftentimes their personality will change. So some people have reported that the person they care for has become more aggressive or more inappropriate, or the memory problems that care recipients have. It's very hurtful to a spouse or an adult child when the person they care for day to day doesn't remember who they are, or gets them mixed up with other people. And so these are things that really stress caregivers, as they've reported to me in my work. Now those things were going on before COVID-19. So how has the COVID-19 pandemic impacted caregiving? So first, I know we hear so much about COVID-19, but I thought I'd put a little bit in about basics because there's so much different information out there, different information that contradicts one another. And so to go over just what COVID-19 is, or coronavirus. So this is a respiratory virus that really is easily spread. So it's spread through droplets that might come out of the mouth or the nose, even just through breathing or talking, but especially sneezing or coughing can spread coronavirus. And there's greater risk with closer and longer contact with others. So when we hear that stay 6 feet apart, or also, try to minimize contact with somebody up close for 15 minutes or less. So the longer you're exposed to another person, the more likely you would be to contracting coronavirus. Now the risk levels vary. Most people who get coronavirus are not going to get seriously sick or die, but we hear so much about those cases that I think it makes some people panic. But for many adults without underlying conditions, that they can contract coronavirus, but they might not even know that they have it, or just have mild symptoms. They might think that they have a cold or a mild case of the flu. And so, as I mentioned, the symptoms vary. So we know that there are some very common symptoms like a dry cough or a fever, but some others have reported all different kinds of symptoms. And so the disease is so new that we don't really know everything about it. And so, so if you are experiencing any symptoms that seem out of the ordinary, contacting your healthcare provider is very important. Now, even if you have never had symptoms, but you're positive for coronavirus, you can still spread the virus. So even though many people will get it and not get sick, that doesn't mean that they can't come into contact with somebody else who could get very sick. And where we're seeing this happening are younger adults and teenagers who are spending a lot of time together, because so far the conversation has been that they're not at high risk. But what happens is, in many of these cases, is that they're going back to their homes, they're going to other community events, and so they are spreading it to others. So one example was in Arkansas, they actually brought their numbers down, and then they had a spike. And the state government determined that they were able to link that spike starting from a pool party from high schoolers who got together and they spread it to one another, had no idea they had it. And so then when they left the party, they all went to different households. And so, so it is possible to spread it even if you haven't felt sick at all. Now, there are a lot of myths out there about coronavirus. So I hear in different circles, people say, well, it's just like the flu. And it's not the normal flu. And so one way we can show it's not the normal flu is just even the rates of people dying from coronavirus. That's also another myth, that more people have died from the flu than coronavirus. So I looked up the statistics. In the last flu season, we had an estimated 24 to 62,000. That is a large estimate, but some people might have had multiple diagnoses. And so, so they're estimated 24,000 to 62,000 estimated deaths from the flu the last year. Compare that with an estimated 166,000 deaths from COVID-19. So we're seeing that it can, even though some of the symptoms might feel like the flu to people who don't have moderate to severe cases, that there is an increased risk of death from COVID-19. And cloth masks. Masks have become very politicized, but they are really important at minimizing spread. But they're most effective when everybody agrees to wear one. So for instance, Alabama, their numbers actually were going up for several weeks right before the recent mandate, mask mandate. Now they are going down. In Georgia, for instance, the numbers started going up. But they've decided to not have a mask mandate. And the most days recently, the new cases of deaths in coronavirus, or cases in coronavirus in Georgia, have been over 3,000 per day. And so having everybody wear a mask when they're out in public is very important. So I mentioned the politicizing of masks. Don't be embarrassed to take COVID precautions seriously. Many caregivers are older adults themselves, have their own risk levels. So for instance, people with diabetes or heart disease or other types of underlying conditions, they are actually more at risk of getting seriously ill from coronavirus. And also, if you're caring for somebody with dementia, what happens if you become too sick to care for them? And so you should not be embarrassed to take COVID precautions seriously. It's not impolite to ask somebody to wear a mask if they're coming in close contact with you for anything. So recently we had to have a service call, and we have not really had visitors to the home. So when I called the company who was sending somebody, I called and verified that the person who showed up was going to wear a mask. And I didn't think anything of, there's no reason why I wouldn't have done that. I was not embarrassed to make sure that that person was going to come with a mask on. So COVID-19 and dementia. So one thing is I talked about risk factors, but dementia itself is not really an increased risk factor for contracting COVID. So getting sick from COVID. So for instance, where I said somebody with heart disease or diabetes, they're at more risk of getting seriously sick from coronavirus. Dementia itself does not increase that risk. However, many of the symptoms of dementia may increase the risk of somebody not following CDC guidelines. So for instance, if somebody has a memory problem or a cognitive decline, how do you, if you're in public with them, keep them wearing a mask if they really don't know, why they're wearing it, or why everybody's wearing a mask, or if they don't remember to wash their hands regularly? And so the memory and cognitive decline, those are the things that would increase risk for people with dementia, not the physical changes from dementia itself. However, COVID might worsen cognitive impairment for someone with dementia. And so somebody who already has cognitive decline, that the COVID might make things worse. And so if you are, if you basically are caring for somebody with dementia and all of a sudden they are getting a lot worse with their cognitive symptoms, you should call that person's healthcare provider and find out more or get them tested for COVID. So another thing related to caregiving, so those are just about what happens with dementia itself and coronavirus. However, there are other things that really have impacted caregiving. So distancing is one thing. So maybe before you had regular respite care, whether it's family members who would come a couple times a week or a couple times a month, maybe you had a service that would come. And now there are increased risk of having respite care. So if you have multiple family members who typically will help you throughout the month, how much are they distancing? How much might they be a risk? Because if you have somebody who's continuing, they have to go to work at the office more regularly, or if they are in contact with a lot of other people on a regular basis, if that's the person that typically has helped you with care, that person might now pose a bigger risk. And then also other types of respite out of the home, adult day centers. For one point, I know that they were closed. I'm not sure if they are now, but evaluating the risk of having other people help with care is a big challenge now. Isolating yourself from older relatives. So whether somebody has dementia or not, people have been having challenges taking care of older loved ones who depended on their support. So maybe if you went grocery shopping for a relative, or you would go in and help with housekeeping, that might not be something that is best for their health at this point. And so evaluating those types of risks and determining if maybe you have to change schedules or change who is helping family members, that's going to have a bigger challenge to caregiving. Inability to visit nursing homes. I don't know if this is universal across states, but many nursing homes in different states are not even allowing family members to come visit. This has been very difficult for families, for those who have visited their loved one regularly, or even those who can only come once in a while, but they like to check up on their family member in a nursing home. This has been especially challenging because nursing homes have been a real big hotspot for new COVID cases. And so what has happened in some cases that I know is that the person has a relative in a nursing home, they test positive for coronavirus. They might not even get very sick from coronavirus, but the nursing home is going to quarantine them in the nursing home. And so the person feels very isolated, even more so, and the family is very stressed. And so that can be a big challenge for families. So many of these things that I'm listing really can further isolate caregivers who already felt isolated. So many caregivers report that they feel lonely, that they feel isolated from others. They feel like they can't leave the home as much as they would like to, or be around other people and do things that they would like. So that was just them and their feelings before everybody else had to isolate in one way or another. And so this could actually make those feelings of isolation a lot worse for caregivers who might be used to having a couple relatives come in throughout the week or month to help out, or even paid workers. And also the impact of distancing can cause confusion for people with dementia. So if all of a sudden somebody in your household gets sick and you have to try to isolate them, that's like a whole new pattern of living space and social interactions within the household, or making people wear masks, or other types of changes that maybe need to be made due to COVID-19. That can cause a lot more confusion for somebody who does have dementia. Another challenge to caregiving is just finding the essentials. So maintaining a steady supply of needed products has been very difficult. I'm sure everybody went into a little bit of a toilet paper crisis the first couple weeks of coronavirus, and so that has gotten better. In fact, I had to go to the store the other day and there was toilet paper in the aisles, and I thought that kind of looked strange at that point, because I don't go to the store very often, and so like the last couple times I went, there weren't any. But I've had a lot of trouble, for instance, locating Lysol wipes over the last several months to keep the house clean and disinfected. There has been a period shortages of hand sanitizer. And so the very things that we need to stay at home and stay, with a higher amount of hygiene to keep us safe and healthy, those things are not always available. There's also been an increased cost of certain goods. So for instance, a number of meatpacking plants across the United States where there was a big surge in coronavirus cases, they've had to close down for periods of time. And that has resulted in some types of foods getting more expensive. Also, because of all the restaurants shutting down, the agricultural industry has had to throw away a lot of their produce that they have grown. And so some foods have cost more than they used to. I don't know how many of you have noticed that from day to day, but they have. And there's also the increased expense of delivered groceries and prepared food. So one way to keep safe, and my family has done this because we're fortunate enough that we can, is that if we want to get groceries or just food from a restaurant, we can order that and have it delivered to our home. But that costs more than previously to coronavirus, where we would just go and to the grocery store or go to a restaurant ourselves and get takeout. And so, but those things are now more expensive. So with all these issues of distancing and not being able to have all of our needs met, really, and this is not just for caregivers, COVID-19 is really impacting mental health. That people across the board are reporting stress and anxiety and depression. And so if you're feeling like you are more depressed or anxious than you were before the pandemic started, you really aren't alone. And that's really important to tell caregivers, because even before COVID-19, I would interview caregivers, and when they would indicate that they feel depressed or anxious, and I would tell them that that's normal, and so many caregivers feel that way, they are very relieved to find out it wasn't just them, that they're just not the only ones who are suffering. So if we look, and this is we look at the information from the CDC and the World Health Organization, the WHO, pandemic stress is actually a thing. So whether you're a caregiver or not, there are signs of pandemic stress. So worries about work, school, and family. School particularly right now. So imagine a family where there's a caregiver, maybe the older parent has dementias living in the home, but the caregiver also has teenage children. And now that schools are reopening and there's a lot of concern about how much there might be an increase in cases, that could be something that that family is really stressed out about and concerned about how to handle that. Other people might worry whether they're going to be able to keep their jobs if businesses stay shut down, such as restaurants. Well, now you can go in person in restaurants, but other states have closed down in-person restaurant dining. and also concerns about family members, that it's very stressful. And I've dealt with this with my students, my colleagues, my own family. When somebody hears that a family member is sick with coronavirus, not necessarily just test positive, there is a lot of stress and concern about what's going to happen over the next couple weeks. And in many cases, you know, I'm very happy to report that the person recovers and everything is fine. But in the meantime, I can see how much stress and worry is in that person's you know, mind when they're telling me that this is something they're going through. And even my own case, so just in self-disclosure, when the coronavirus started, my dad got very sick with a respiratory condition, and he lived in Florida, and he got worse and worse, and he was hospitalized, and he was released. They found out that it's funny to say it was just pneumonia. So we kind of laugh now that we said it was just pneumonia, because it wasn't coronavirus. He's tested negative several times and tested negative for the antibodies. But even though something like pneumonia, which is more commonplace than coronavirus, I really didn't sleep for a whole week because I was so worried about this. And during that week, I still had to go to work, complete all of my obligations to my family. And so it was a very stressful week, but that's the level of stress that people are going through when they hear that somebody is sick. There might be changes in sleeping patterns. So in some cases, to cope with depression, some people are very tired and they'll sleep many hours. Other people, that they tend to not be able to sleep when they're stressed. So in terms of difficulty sleeping or even concentrating, those can be very much signs of stress and depression. And many people are reporting that there's an increased use of tobacco and alcohol to cope with coronavirus stress, even though that's not a healthy way of coping. This is something that we're finding people are doing. And worsening physical and mental health conditions. One reason for this is people are afraid to go to their doctor for other things that they need to address. And so I know I have family members and friends who are nurses, and they're saying, well, we're not seeing as many people with heart attacks or coming in for other conditions that they typically come in for. And so, so those conditions could be worse in the long run. And in fact, recently, Dr. Fauci was talking about fewer people are getting cancer screenings at this time when we're distancing. And so there might be some effects on cancer rates later on due to that. Now, in talking about all these risks and challenges, it's also important to know that African American and rural caregivers, they're at greater risk of negative outcomes associated with both caregiving. So we find that African American and rural caregivers, that they tend to have less access to services or high quality services. They tend to have poorer outcomes than non-Hispanic white caregivers, but also with COVID-19 can be a problem. So for instance, in rural communities where there might not be as much many ICU beds or healthcare facilities or hospitals, those could be challenges as well. And so those are particular populations that we really need to additionally support because they are at greater risk. So those were all the challenges. So that was all the stressful things that everybody's been thinking about and concerned about. But in terms of turning that around and being more proactive, what should we be doing as caregivers? So first, keeping you and your family healthy. Remember that you are the person who is there for the individual with dementia. And so oftentimes caregivers don't take care of themselves because they put the person with dementia first. And that's very understandable. However, I always tell caregivers, if you're not there to provide that care, what's going to happen to that person's care? What's going to happen? How's that going to impact your family? And so I remind everybody that, like, when you get on a plane, the flight attendant tells you that if the oxygen mask comes down, to put it on yourself before helping others. It's the same thing with caregiving. And so making sure you and your family are healthy is really important. So first, follow CDC guidelines. The guidelines aren't made up. These are a lot of scientists and public health professionals who throughout decades have designed these guidelines because they know that they are effective. So stay home as much as possible. We did have in Alabama a stay-at-home order for a period of time. Now that has turned into safer at home. But I get the impression that many people don't now take staying at home as seriously as they did during the stay-at-home orders. And I understand it's really hard. I have not had a haircut since December. I don't get to see my family. I don't get to do a lot of the things that I really enjoy doing. That's outside of the home. And, you know, I've been staying at home since March 13th. And now it's getting harder for families. So we have family members who live nearby. They don't understand why we're still not coming over for barbecues or why we're not going to do things with them, like go to a restaurant to eat outdoors. But the more people who stay at home when they can, the safer it is for everybody in the community for not contracting coronavirus. Wear a face covering in public, very important. Now that we have the mask mandate, I see more people who are wearing them out in public in Alabama, but there are people who don't. Some people don't feel like the masks are effective, and that's not correct. But they're most effective when we all wear them, and also wear them appropriately. So, you know, I see so many people who wear their masks and they keep it below their nose. And so, you know, your nose is still connected to your lungs, and actually your nose is more susceptible of getting coronavirus than through your mouth. And many people don't understand that. Masks are not comfortable. I don't like wearing them either, but I wear one when I leave. And even when I go jogging in the mornings, if I'm at a park where there are other people and I can't stay 6 feet away, I even have a covering that I can move up and down my face when I pass people, so I don't, I can protect us while exercising outdoors. So stay more than 6 feet away from others. And like I mentioned, even outdoors. So I feel like public parks have become so popular in Alabama now that people have fewer indoor places they can go to for recreation. But I also noticed that many people are not distancing while they're at the parks. Now, it is true that you're less likely to get coronavirus when you're outdoors, but that doesn't mean that it prevents you from getting it. And so if you are out at a park or other outdoor setting and you're in close proximity to everybody else, that's not necessarily still putting you at a zero risk. And also wash your hands often. So it's very simple, so that if you touch a surface that is contaminated, you don't contaminate yourself. And limit visitors to your home. So we're actually in a childcare sharing situation. So we have my stepsons come every other week. And so because they come every other week and they also have another household they go to, we don't allow anybody else in our house. So even other family members, so maybe they'll come and we'll stand on the lawn and talk with them at a distance or do other things, but we don't let anybody else in our home. We keep it limited. And also ask your doctor if they offer telehealth for non-urgent visits. So if you do have to go to the doctors for something, calling ahead and seeing if it's something that you can talk to them over the phone or over a video chat, those are things that could keep you safer than having to go to a medical facility for something else. Now, staying mentally healthy is for many people a bigger challenge. So if you are feeling depressed or anxious, talk to your doctor. That's something else that can maybe be done over telehealth. And so you wouldn't have to go to the office to talk to them about it. But feeling depressed and anxious, you know, it's not normal. And so, but many people are experiencing it. So even though it's widespread, that there are things that you could do and you could talk to your doctor about what those things could be to reduce your depression or anxiety. Try to develop a new routine as old routines may have changed. So, you know, and I'm actually was guilty of this. So I like to wake up very early in the morning. I'm like a 6 o'clock jump out of bed person, and I'd go to the park and I would go running every morning, even during the pandemic. And so what has happened, for whatever reason, I have trouble waking up at 6 on my own now. I wake up maybe around 7 or 8, where now it's a little hotter at that time and it's too hot. And I got really depressed because I wasn't going to the park to exercise every day. We have an exercise machine in the basement. And so what I realized, I don't have to exercise at 6 in the morning every day. So if I wake up at 8 and I want to go then, or maybe I want to go start work and then I exercise later in the afternoon, me just getting out of that routine and changing it up made me so much happier because I still felt like I was getting exercise, which was important to me, but I wasn't trying to do it against whatever my body's trying to tell me. I don't need to wake up at 6 right now. And so that was okay. Find new ways of enjoying hobbies. So, whether or not there are ways that we can do our hobbies at home or in different ways. So we have a shuffleboard table in our basement. And so whereas my husband and I used to like to go bowling at the bowling alley, we bought a little bowling set for the shuffleboard table and we play in the basement now. And have patience with yourself. So it's very easy for people, especially those people who everybody else looks up to keep everything together and keep everything moving, to just lose patience with yourself. And this is not the time to do that. Understand that this is challenging. These are challenging times. And so if you're not feeling like you're doing your best, you most likely are. It's just everybody is having a difficult time right now. But it's easy to not realize that other people are having a hard time because we're all isolated. So if I'm stressed because I feel like I'm not keeping up with everything, I don't see what my coworkers are going through, that they're experiencing the same things because they're at their homes dealing with all of their things there, and I don't get to see that. Now, in terms of services, so if you are having in-home service providers, so this is keeping everybody safe, find out the agency's protocol for COVID prevention. So if you have a respite care provider that comes in, they most likely actually are going to other people's homes too. You're not the only home. So what does the agency do if they find out that one of their clients is tested positive, or if one of their workers is tested positive? What are they doing about preventing the spread of COVID-19? Call them and ask them and make sure that they have a plan in place. Do not allow a worker in your home who has a fever or is sick. So going back to, don't be embarrassed to follow CDC guidelines. Don't be embarrassed if somebody appears sick when they show up to your house or feverish to say, I don't think you should come in today, and call the agency. Ask in-home workers if they've been exposed to others with COVID. Again, don't be embarrassed. Hey, so you're probably seeing a lot of families. Has anybody else that you've come in contact with tested positive for coronavirus? And make sure that workers wear masks and wash their hands when they get to your home. Not just when they're leaving, not just during duties, but have them wash their hands as soon as they get to their home. Now, some of you might have loved ones in residential care, and that can be especially challenging, and many nursing homes will not allow visitors at this point. So just like the in-home agencies, check the agency's protocol to see what they're doing about prevention of coronavirus. Now, you can also ask if you can visit your loved one without personal contact. So the nursing home might have a place in the building where you can come to the window and your loved one can be on the other side of the window and you can see them and interact with them that way. If there are other ways that the nursing home can facilitate visits where you're not coming in contact with the workers or the residents, then that's something that could be explored. But even in those cases, do not go visit your loved one in any type of residential care, nursing home, independent living, assisted living. Do not visit anybody if you are sick. That's very important. And you might want to consider other ways of communicating. So telephone, video conferencing, if they can put an iPad, for instance, in front of your loved one, and you could FaceTime with them or use any other, and I'll go through some of the examples of different apps that you can use to keep connected. Now, planning ahead. Now, there might be a case where somebody in your house does test positive for coronavirus and or even get sick from it. So consider whether you have an area in your home that has a bathroom with it that family member can stay on their own and quarantine for 10 to 14 days. It used to be just 14, but now the CDC indicates that going by the symptoms, if after 10 days you don't have symptoms, as opposed to just a blanket 14 days. So making sure that there's some place that the person can go in your home. Have a care management plan in place in case you get sick. So if you get sick with coronavirus, what's going to happen to the person you provide care for? Do you have a backup plan? And consider alternate plans for adult daycare or respite if possible. So if you have a senior center or adult care facility, is there other types of arrangements that you can make to help you get time to yourself? And most importantly, we keep saying social distancing, but we're really just physical distancing. It doesn't have to be social. We don't have to be disconnected from people we care about. So catch up with family and friends through teleconferencing. That's very important. So this could be FaceTime or Facebook Messenger, for instance. Zoom, we're on Zoom now, but you can get a free Zoom account to use with family members. Consider virtual group get-togethers. So not just one-on-one, but for instance, my siblings and I, so I'm the oldest of 4, and we live in all different states. And so once in a while on Saturdays, since the pandemic started, we found some board games that we're able to play over video conferencing. And so we'll organize a game night on the Saturday evenings once in a while and actually play games, not just talk, but do something fun that we all enjoy. And you can also arrange for in-person meetups where everybody stays more than 6 feet apart. We did this the other day. My mother-in-law came over, and so we had lawn chairs placed out very far apart where we could see her and hang out and catch up with her. And we're not really in close physical contact. But also participating in online support groups. So there are online support groups many agencies will offer, or if you were in an in-person support group beforehand and now they're not meeting, if you can connect with people in that support group, maybe just for a check-in once in a while, finding other ways of getting to those support groups can be very important. But remember that we have so many technologies today that can help you stay connected. So I mentioned Facebook Messenger, Zoom, FaceTime. There's all different ways that Skype is another one. They're very easy to learn how to use if you've never used them before. And so finding ways to use them to stay connected with other people can really help with our mental health. And importantly, avoid myths and scams. So there are a lot of myths and misinformation about spreading COVID. So go to the CDC or WHO website in order to find out if those are true or not. And don't share stories you cannot verify. So if you see something written on Facebook and you're not sure, it doesn't seem like it would be true, it can be dangerous to share that with others. And also with scams, fraud reports in Alabama doubled from April to May this year. And some of this is related to, fake testing, fake treatments, or even the stimulus money. Excuse me. So there are scams related to those. So if somebody calls and something doesn't sound right, just hang up and try to verify what they were saying, or even call the state to find out more about what they're saying on the phone. And this is my last point. There are many people who are in crisis right now who there are not other people to have eyes on that person because we're distancing. So if you or somebody you know is at risk of suicide or domestic violence, child abuse, if you have veterans who are in crisis, call 911 for any emergency. But here are some phone numbers that you can call about some hotlines that will help you if somebody's in crisis or if you're in crisis. So, if you're in a situation where you're a victim of domestic violence, and now people are staying at home and you don't have others seeing what's going on, that can make a situation worse. And so there are phone numbers that you can call or have other people call or call for other people if they're in any type of these crises. And that's everything that I have today for the COVID-19. My email address is here, nruggiano@ua.edu. If you have questions or follow-up after this session, feel free to reach out and I can help answer or, find if there's questions or support is needed, I'm always available via email.
Thank you.
Nicole.
Let's see, where I get back on.
There were a couple of questions, Nicole. Someone asked about wearing gloves, if it was worth the extra effort when taking mom to the store, and also about agency protocols, do's and don'ts. What should they look for?
So, I mean, I don't believe that there's any harm in wearing gloves, but from what I've read at the CDC, that there's really not as much benefit. It's actually more effective to not wear gloves and wash your hands more frequently and use hand sanitizer than gloves. I do see people wearing gloves who go to the grocery store. It might be people who personally feel more protected by them, but there really isn't a whole lot out there from public health saying that we should be wearing gloves.
And then agency protocol?
Oh, an agency protocol, do's and don'ts. So actually, the federal government, like if you just Google COVID-19 and nursing homes, there are federal sites that will tell you what some of the protocols they want nursing homes or require nursing homes to have. So there is, for instance, somebody needs to be there at the agency who is dedicated to the topic of infectious disease prevention. Or how do they go and notify residents and families if somebody's been tested positive. And so the different type of agency, there's going to be different levels of risk. So a respite care service would be different than a nursing home. But, especially just thinking, do they have people and protocols in place if they find cases? What do they do if somebody tests positive, and how do they notify clients and family? The last thing you want to find out is that people have been coming to your home who've been exposed to COVID-19 and you never knew anything about that. So you didn't even get to make a decision about whether that person should come in your home. So, those are the main things. But also, what are they requiring workers to do at the homes or in the nursing home? When are they supposed to wash their hands? How often? Those types of things are very important. Things that the CDC is saying you should do, you should make sure that they are doing that as well. Oh, and back to the grocery store question. So I get groceries often delivered to my home, but if we have to go, so if I have a prescription or something, the way that I have been doing it, not that this is the best way, but I put my mask on before getting out of the car. I go into the store, and as soon as I get out and I don't wear gloves, I use hand sanitizer before I take off my mask. And it's also important, take off your mask from your ears, not from your face, because then you're touching your face with your hands, but taking them off from your ears. But so, go into the store, I come out, sanitizer, and then when I get home, after I put all the groceries away, I wash my hands in case there's anything, on them, but that's as less risk than just being in contact with people. And
All right. Well,
and I also mentioned that individuals can find ways of using technology in order to stay connected, but we actually just did a small study where we used private Facebook groups to facilitate support groups for caregivers of dementia. It was very small. We had 8 people participate. But if there are agencies out there that are interested in ideas on how to, in a free and easy way of getting some of their services, my specialty is using technology for dementia care. So if there are agencies out there, and some of you might be participating, who just want ideas on how to maybe put more services or support virtually, feel free to contact me, and I'm open to talking and maybe brainstorming ways that they can do that in a free and very cost-effective and efficient way.
Good. Okay, Nicole, thank you so much for being here with us, and that was some great information and a lot of practical information that we all need right now. And I hate that you can't see us all clapping for you, because we appreciate it very much. If you've got a CEU question, let me just run through that again. Sherry has put the link in the chat box. If you are calling her, if you are calling in, if you're doing this by phone, you will need to email Sherry, and her email address is also in the chat box, to request the survey. Now, Carlette is watching, and you've got to have been on the call the whole time to get the CEUs. That's really important. And you've got to turn your survey in by close of business tomorrow. That's Friday. And I also wanted to mention our next webinar will be at the same time next Thursday at 1 o'clock. That's August 20th. And we've got another really great dynamic speaker, Daphne Johnson. Daphne is the inspiration behind the respite movement. She is not with adult daycare, which is what Alzheimer's of Central Alabama has been very involved in. These are respite programs with volunteers. She started a foundation called Respite for All. She's just written a book, but the topic of her presentation will be mindset transformation in dementia. So I think that will be another good one. And if you know of someone that you think would benefit from the information that Nicole has presented, this webinar will be on our website, probably by tomorrow, but definitely by Monday. So you can check back to see this webinar or any of the ones that we have done this summer. So Carlette, I want to thank you again for your help with the CEUs. And that was with Human Resource Options. And Nicole, just a great big thank you to you for participating and for everything you do on behalf of caregivers in Alabama.
Thank you. It's my pleasure.
Okay. Thanks, everybody.
Bye-bye.
Bye.